Hello and welcome to Motors and Medicine. On today's episode, I'm going to be discussing cholesterol. It's a topic that a lot of people ask me questions about. I actually review a lot of information about cholesterol with my patients on fairly a regular basis. I review a lot of labs and in my clinic, and then it's just good to have this information and know where you stand. Okay, a lot of people understand that cholesterol, sometimes they understand it to be a good thing, a bad thing. Sometimes they sort of understand foods, numbers, and I'm going to try to go over like the basics so that you get a good understanding of what cholesterol is. So, first and foremost, cholesterol, what is it? It's basically like a fatty, waxy substance that is in your bloodstream. And its main purpose is to aid in the production of hormones and vitamins. It also serves as the main structure of cell membranes. So it's really important for cellular function in your body, okay? A lot of your cholesterol comes from your liver that makes it, but most of your cholesterol comes from your diet, what you consume. So ideally, you want to try to keep cholesterol at a certain level or number. So we're going to go over normal values. So the normal value for total cholesterol, which is what you're going to see when you go to your doctor and they do a lipid panel or cholesterol panel, they're going to give you some numbers. So total cholesterol, you want to see a number that's 200 or less. Anything above 200 is considered abnormal, borderline. And then if it's grossly over 200, like 300 or 400, now you really have a problem with excessive cholesterol and changes need to be made. So total is 200 or less. That's the goal that you're looking for. Now, the next number that you typically see on the labs is LDL cholesterol. And that's basically what we call your bad cholesterol. And that comes from sources like red meat, fatty foods, eggs, things like that. Those are things that you have to try to watch not to eat too much of, because then you'll get too high a level of LDL. Now, the goal for LDL is to be 100 or less. And again, anything above 100, and it's measured in milligrams per deciliter, if I'm not mistaken. But anything above 100 is abnormal, and you really want to try to make adjustments to diet and or exercise. And we'll discuss medications in a minute. Now, the next number that you typically see is triglycerides. And that's another number. Triglycerides are basically free fatty acids that exist in your diet. And they're not necessarily useful, but they're typically found in things like hydrogenated oils, fatty foods, red meats, things like that. So again, things that you need to kind of eat in moderation. The number for triglycerides is 150 or less. So if you have high triglycerides, which diabetics tend to have, for whatever reason, that their metabolic cycle is kind of skewed a little bit, so their triglycerides tend to go up a little bit. So if you are a diabetic, you definitely need to watch triglycerides even more than if you're not. So again, 150 is the number you're looking for or less. And then finally, good cholesterol, which is called HDL, that's the protective cholesterol. That is the cholesterol that we get from eating healthy fats and things like omega-3 fatty acids, for example, lots of fish. And so with HDL, if you're a male, your normal should be 40 or higher. Desired is typically 60. And if you're a female, your number should be 50 or higher, and desired is also 60. However, genetics play a big role on HDL. I'll give you my personal example. My HDL happens to be right around 40. I've never seen my HDL go any higher than like 42. And that was with every conceivable method of trying to elevate my HDL, which we'll discuss in a minute. But the bottom line is HDL and even your other cholesterol numbers, a lot of the time are dictated in some part by your genetics, but diet will play a role. So again, the number that you're looking for there, if you're a man, 40 or higher, 60 is desired. If you're a woman, 50 or higher, 60 is desired. Now, We'll talk about why it's important. The first thing is you want to maintain a good ratio of total cholesterol to HDL. Now, again, we discussed total cholesterol. You want your number to be 200 or less, and you want your HDL to be, if you're a male, 40 or higher. If you're a female, 50 or higher. Now, I'm just going to demonstrate a typical ratio, easy math. If your total cholesterol was 200, you basically take your total cholesterol and you divide that by your HDL. So if your total cholesterol was 200 and your HDL was, say, 50, easy math, the ratio is 4-1. Now, we like to see a ratio of less than 5-1, or I should say 5-1 or better, lower if you can, 4-1, 3-1, those types of things, to reduce your risk of cardiovascular events, heart attack, stroke. And it's fairly easy to accomplish if you can maintain a few things. And I've discussed a few, kind of briefly mentioned a few regarding diet, avoiding certain things. Now, when it comes to diet, ideally what you want to try to do is focus on eating a higher level of omega-3 fatty acid containing foods like fish, salmon, for example. Try to avoid a lot of red meat and a lot of fatty foods, greasy foods, fast food, things like that. There's nothing wrong with eating those on occasion. It's just eating them on too frequent a basis. That's when it becomes an issue. On the exercise side of things, the main thing to focus on is resistance weight training. And the reason for that is that resistance weight training greatly increases your HDL numbers. Now, HDL, it's a great cholesterol. We know it's protective, but the higher your HDL goes, the more protective it is, of course. But if you have a really high HDL and you have a relatively low cholesterol to HDL ratio, a lot of your other numbers like triglycerides or LDL can essentially be erased by that HDL. So if your HDL is really high, like say 60 or higher, and you happen to have, say, a borderline maybe 220 total cholesterol, and your LDL or triglycerides are very elevated for whatever reason, the HDL being very high at 65 protects you against that triglyceride or high LDL level. It's almost like erasing those numbers or reducing them just because your ratio of total cholesterol to HDL is so good. So that's something to keep in mind. Resistance weight training, extremely good at raising HDL. Now, another good way to raise your HDL is to use niacin as a supplement. Now, it all depends on how much you can tolerate. Niacin in small doses is pretty tolerable. I use a niacin supplement on a daily basis, but my dose is very small because when I was taking a higher dose, I think I was taking, I can't remember if it was 50 milligrams or higher, it was a little too much for me, and I was starting to get some red flashes, which is something that you get like a side effect. It's like a vascular side effect from niacin. Now, if you can tolerate low-dose niacin or just a standard niacin supplement, just that without a prescription, it would really help get that HDL up, especially when you combine that with resistance weight training. And then the last thing I'm going to talk about, of course, is just medications. So you really need to be vigilant with going to your doctor and finding out what your lipid panel is. A lot of people are just in the dark about it. I know that many people just, for whatever reason, feel that if they feel happy, if they feel healthy and strong, they may not need to go to the doctor for any reason. But the one thing is that cholesterol is considered one of those silent killers, just like diabetes, just like high blood pressure. It's one of those things that you really need to be on top of. You don't want to have elevated cholesterol because it greatly increases your risk for heart attack, stroke, and other things. So if you happen to have an issue with it, try to realize that you're going to be saving yourself and your family heartache by checking those numbers and just figuring out where you stand. So go to your doctor, get a lipid panel, and find out what your ratio is. then you can kind of know, well, do I need to make changes to my diet? Do I need to make some exercise adjustments? Perhaps start a niacin supplement, whatever it is. But ideally, you just want to be on top of that and follow it on a regular basis. Probably once a year would be fine, unless you have a family history of high cholesterol, high blood pressure, diabetes, any other comorbidity that you may have, you yourself or in your family. Definitely check those numbers more frequently. And as a side note, if you happen to have high blood pressure or diabetes, your cholesterol numbers need to be even better than the 200 for your average person. Typically, we like to see 170 or less if you're diabetic. And if your total for LDL, the number that we like to see is 100 or less. But if you're diabetic, we like to see 70 or less. So again, if you happen to have some of those conditions, it's even that much more important to know where you stand on your cholesterol numbers. So hopefully this video provided some good insight and information about cholesterol, what it is, how it works, how to manage it. And of course, as I was mentioning earlier, medications are one of those things that if you happen to be either genetically elevated with cholesterol or just have a poor diet, whatever it is, medications are extremely good tools for reducing cholesterol. And so that's another thing that you'll discuss with your doctor when you get these labs done. So again, I appreciate all of your guys' support. On the next upload, I'm going to be doing a 1-year review of my 21 Bronco. So until then, please like and subscribe. And this is Motors and Medicine signing off. Till next time.